My name is Richard Ceruzzi. I'm a medical specialist, a physiatrist. I've started Seattle Spine and Sports Medicine 25 years ago, and we've, in the last few years, started Brain Injury Medicine of Seattle, which is sort of a clinic within a clinic. We treat patients who've had injuries, for example, from motor vehicle crashes, and we've started a newsletter called Healing Pains and Brains because we try to do both of those things. If you were my patient, had a head injury from being in a bad motor vehicle crash, for example, I actually think of the overall spectrum or the overall range of what can happen after a head injury in terms of an acronym I came up with. And it helps me remember so many things that we have to address when you've had a traumatic brain injury or a TBI. We look at, I call it eco-vapes. We look at the emotional impact of an injury, the cognitive, what's called the oculomotor in terms of visual things that can happen after brain injury, vestibular in terms of loss of balance that occurs with some patients, the autonomic, which can be like a fight or flight response that people develop, as well as some other things in terms of not being able to feel balanced when you go from lying down to sitting up to standing. We look at the physical, headaches, neck pain, which often comes with brain injuries as well. We look at the endocrine, the pituitary gland, a gland in your brain that controls your hormones, can get injured after brain injury. And then finally, we look at sleep. In some ways, we have to look at sleep first. But sleep is very important. It gets affected both by regular physical injuries, like whiplash injuries, but also even more so when someone has a traumatic brain injury. If we were to break down these various areas of potential injury or loss of function, looking at the emotional, what often happens for patients when they've been in a motor vehicle crash, for example, or another kind of trauma, is they actually get some post-traumatic stress symptoms. They flash back to the injury. They might even have nightmares. They become what we call hypervigilant. That's a $50 term for when they're in a car, they might really get quite tense. And a lot of that's kind of normal after an injury, but if it's something that persists or interferes with one's function, we really have to bring you to a mental health counselor. Sometimes we prescribe medication as well to try to help you unpack that trauma. So one of the modalities we use in mental health counseling is EMDR, eye movement desensitization and reprocessing. It's a technique that's been shown to help patients with post-traumatic stress and allows them to unpack in a safe setting with a trained counselor the emotional trauma that they have had. And once they can do that in a controlled setting, it helps them move past the trauma. Clearly, one of the big issues with a traumatic brain injury is loss of cognitive function. The most common things patients talk about is they feel their short-term memory is affected. But actually, it's as much their attention and concentration, as well as some other things we take for granted, like multitasking, the ability to hold on to 2 or 3 things when, for example, when you're at work. Something we call anomia. That's a fancy word for saying difficulty finding words. So you say to someone who's had a head injury, what is this called? They go, shirt. And then they say, what about this part of the shirt? What's that called? And they can't find the word collar easily. You say, well, it's attached to the shirt. It's some talk around words or transpose words. It's very common. We do have cognitive therapists on staff, highly trained. These are clinicians at the master's level who specifically are trained to help people regain their cognitive function and initially, at least, assess their cognitive function, which is very important, for example, in order to give us an idea of the baseline we're working with if you have had an injury. If we talk about oculomotor dysfunction, that's a fancy word for visual problems that occur after, for example, a head injury. And this is actually a model of the cranial nerves. It looks a little bit on the gruesome side, but anatomically it's very important. It shows us the location of the various cranial nerves, the nerves in the brainstem of the body just below the cortex. And these nerves often are affected after a brain injury, especially the nerves that control movement of the eyes. So for example, it's very common for one of my patients to say, yeah, my eyes have gotten blurry after my injury, and I have a real eye strain, and I get headaches when I'm looking at computer screens or working. I went to my eye doctor, and they said my vision's normal. Now, how could that be? Well, the eye doctor, unless they're specifically trained, they're just looking at how well you see, your visual acuity. Think of the eye chart at a doctor's office. But a neuro-optometrist is somebody who actually is able to see how well the eyes track together, what we call oculomotor function. And that's something that is very often affected by a brain injury. Another area of traumatic brain injury that we address is vestibular function, or really balance problems. Now, the vestibular system is in the inner ear, and what it does is it helps control your sense of where you are in space so you don't, for example, fall, or so you can coordinate your movements. And it's very common after a TBI or brain injury for patients to have problems with balance. And there's any number of reasons why that occurs. And we, again, help to unpack that at our clinic. And we have highly trained vestibular therapists. These are physical therapists who are trained in balance disorders to work with you to help you regain your balance. If they cannot help you enough, we start looking for more unusual disorders. For example, third mobile window syndrome, which is a very actually relatively common disorder, but very commonly not diagnosed. And we work with some of the top ear surgeons in the country to try to help us gain this diagnosis if you're not improving. Autonomic dysfunction after a brain injury. What is the autonomic nervous system? The autonomic nervous system is made up of a few things. It helps us with what's called the flight or fight response. So kind of tied into the emotional problems that occur after a TBI, patients may have this sort of fight or flight response with very regular things in life. And that is not normal. It's not healthy. We're trying to get things out of that very primitive kind of fear system into something that you can process more normally. So if the patient is in a car and they have this post-traumatic stress, their fight or flight system kicks in, and we want to work on that. There's another part of the autonomic system which helps us with maintaining balance when we go from, say, lying down to sitting up to standing. We take that for granted that we can just sort of stand and not get dizzy. But actually, mechanically, that's pretty hard on the body because all the blood that's down in your legs will tend to pool down there. And unless you have good mechanisms for pumping up that blood better when you stand, you will get dizzy. Well, it turns out that that mechanism for maintaining that balance, that autonomic function, actually can be hindered after a traumatic brain injury. So we need to address that as well with at least some patients. So if we look at the physical injuries that are associated with TBI, that is probably one of the areas where our clinic can really offer unique value for our patients. You know, if you go to a neurologist after a head injury, nothing against my neurology colleagues, but they will often focus on your headaches. They might focus on getting you cognitive therapy, but they don't very often have a good grasp of some of the other reasons why patients might have headache after a motor vehicle crash. And it's almost inevitable that if you concuss your brain after a crash, you will also have an associated neck injury. There are rare exceptions, but that's by far more common than it is not. And we address both areas, the post-concussive headache, but also the headache that's associated with injury to the upper cervical joints. We use modalities like platelet-rich plasma, PRP, to help your body heal from these types of cervical joint or neck joint injuries if you're not otherwise healing with chiropractic and other non-invasive treatments. It's also very common for patients to have back injuries, low back injuries after a motor vehicle crash, or shoulder injuries, or something called thoracic outlet syndrome, where they'll have numbness, tingling, pain, and weakness in their arm happens to female patients much more than male patients. And our clinic has a lot of experience and I dare say expertise with treating these kinds of problems. So another area that is affected after traumatic brain injury or TBI is the endocrine system. So the endocrine system is the system in our bodies that help regulate various processes, our ability to maintain sleep, to avoid fatigue, to build muscle, to maintain a normal metabolic activity. And one of the chief centers that controls the endocrine system is the pituitary gland. The pituitary gland looks like sort of a sac. It is literally a sac, just behind the nose. And it sits in a little bony area called the sella turcica. That means Turkish saddle because it looks like a Turkish saddle. And it turns out that some patients with TBI can actually have injury to their pituitary gland. That's only been really understood in the last, I'd say, 10, 15 years. It's often missed by other providers. You have to be aware of it. You have to do very specific kinds of blood tests for screening. If your screening blood tests show an abnormality, most often with growth hormone deficiency, you need more specialized tests, and our providers will try to get you to a reputable source for doing that more specialized testing. One of the problems with detecting endocrine disorders after TBI is that the symptoms of, for example, growth hormone deficiency greatly overlap with traumatic brain injury. What do they cause? Fatigue, weight gain, loss of muscle strength, loss of cognitive function. That happens to a lot of people with brain injuries as well. One area that is probably a pillar of well-being that we need to address, not just with traumatic brain injury, but with any injury, is sleep. Sleep disruption after traumatic brain injury or even physical injuries without TBI is very common among our patients. It can be from any number of things, chronic pain, for example, headaches, neck pain, back pain, but also from anxiety, from primary disruption of your sleep architecture, your sleep circuits from the brain injury itself, and it can have devastating long-term consequences. We try to address sleep disruption in our clinic initially by recommending things like meditation, long-acting melatonin. If those things are not helpful, we move towards non-addictive muscle relaxants. And ultimately, we might need to send you for sleep studies. I like to say in my clinic, with or without TBI, there are really two cornerstones of, quote, non-physical loss that have to be addressed. Number one is if there is a degree of post-traumatic stress. If that does not resolve within a few months after an injury, we do have to address that more aggressively. And number two, and more common, is sleep disruption. And what I say to my patients is, look, if we don't address those, we're going to be filling a leaky bucket. We got to plug those leaks before we can make any kind of progress with your other injuries. It's really fundamental to recovery. What I'm holding here is a model of two hemispheres of the brain. And I'm bringing up the brain model just to emphasize that one other thing that we will pay attention to with our patients is whether they need advanced brain imaging. Routine MRI scans rarely show mild traumatic brain injury. There are certain sequences which are helpful. I won't get into them here because they're kind of technical. And if patients need a more advanced quantitative technique for detecting brain injury, we can make that referral as well. It's often much more specialized. What we are trying to do, at the risk of being corny here, is we're trying to take you and put you back together. That is the goal of our clinic. And we work in an interdisciplinary setting for our patients. We work with vestibular therapists, neuro-optometrists, mental health counselors, pain management specialists, sleep specialists, cognitive therapists. It takes a team. And the reason it takes a team is because there's an adage, there's a saying. If you've treated one brain injury, you've treated one brain injury. Everybody's different. One patient has this kind of problem, another has that kind of problem, and it takes a comprehensive, interdisciplinary approach to get you back to who you were. My promise to you at Brain Injury Medicine of Seattle is that we're going to try to put you back together. Thank you.